That moves me into my third question, which is how has this transition affected your ability? We live in a results-based economy, right? At the end of the day, you and I have to deliver, and there's a lot of meritocracy in what we're doing, as membership requires people to pay outside of their health insurance. So they're writing a check to us and they're hiring us to deliver a big result. And I like that because I like merit-based things. But as you are looking back over the last 6 months and looking forward over the next several years, and you now see the capacity for you to provide this excellent care, what would you say is the thing that has affected you the most in terms of providing world-class excellent care?
I'd say specifically, and this is a determination that I think we've kind of stepped around in this conversation, but is very pertinent here, is the difference between really personalized healthcare and maybe more of a public health healthcare perspective, which we've, I think, touched in that, but this is very pertinent to how I can now care for patients, in that we're free of many of the restrictions and checklists that are just based on studies involving the public. There's obviously value there, and those things are always considered, whether it's, a colonoscopy recommendation or a flu shot recommendation. Those are public health considerations that we of course consider. But we're also to take it to a deeper level where we get to say, well, here's your story.
Yes.
Maybe a colonoscopy needs to occur a little earlier due to your family history or due to certain symptoms you've been having or whatnot. Same with vaccinations or other discussions that are often seen on the news or other avenues, where we're able to put that public health recommendation through the lens of this person, this member. Yes. And it's really beautiful and really almost impossible to fully explain. An analogy I find myself talking about with many patients is a simple fishing analogy. And I'm not a fisherman. I'd like to be, but I'm not one. But it's when you cast out your line, and you can just let your hook sit, and you can have done the best cast you've ever done. But if that hook just sits, you're never going to get the fish. You've got to follow through. You've got to reel it back in. You've got to go through the whole process. And I think that's been a beautiful mental analogy for me, but also for my members, as maybe I have a prospective member I'm kind of explaining our style of care. It's the follow through. It's the, hey, we give you the thought, we give you the goal, the purpose, and then we bring it back in and we make sure that we caught the fish. We make sure that it worked. And I often, just because I don't want the member to feel too much pressure, nobody likes to feel pressure, and this is just truth, that, if the line we cast out doesn't work for them, if that strategy, if that goal we set wasn't attainable, or they weren't able to go through a certain process, that doesn't mean anything except we need to rethink that program. Maybe we need to turn around and cast in another direction. Yeah. The fish are behind us. They're not where we thought they were.
Maybe change the bait.
Change the bait, And that's the beauty of this style, where you're not just constantly throwing out lines and hoping you catch a fish. It's the follow through. I use the word intimacy a lot in my doctor-patient relationship talk, which I think is just, I can't come up with any other word other than it's such an intimate, close relationship. And with that relationship comes those continued discussions, the simple questions of, well, how are you doing? Did what we talk about, did it stick? Do you have any questions? You take that second, third, fourth step that in other models, you're limited in the ability to do that.
100%. I use an analogy often that, like, if your primary care physician is a carpenter, he has a tool belt or she has a tool belt. But in the current state of things, the only tool left for them to use is a hammer. And so when the only tool you have is a hammer, everything's a nail. Which is why you get this kind of generic formula. Like, it's better than nothing, but this population-based health. where based on studies we did on population health, the hammer is the single best tool.
Mm-hmm.
We have the capacity to load our tool belt, you and I, with an infinite amount of tools, vet them, test them, evaluate them, measure them, and then consider them for a member, because we don't do population health. We do health of one on one on one on one. And there may be tools that I have on my tool belt that I develop that capacity just for you. And I may not use that again for another 10 years, but it's the perfect tool for the job.
Mm-hmm.
I had a tree that went down last week. There were some huge storms that came through Nashville, and a massive limb, probably several thousand pounds. And it's a daunting task until you get the right tool. Went to Home Depot, rented the perfect chainsaw, thought it out. 10 minutes. I had that thing chopped and stacked. Another 10 minutes, I had a buddy's truck. So with the truck and the chainsaw, it was an hour job. But if I pulled out my hatchet, which I love, wouldn't have been 10 minutes.
Mm-hmm.
And I see a lot of that. And I also gave myself the whole day to do it, so I wasn't beholden to the clock.
Mm-hmm.
But it was kind of remarkable. It kind of struck me as kind of comical as the job was done. I was like, wow, these really, really scary jobs are quite simple if you have the right tools.
That's right. It's a great analogy.
Well, this has been really great.